recognized that many people were using the emergency room as a primary care, somewhere where they could get health care because they were not having access to it out in the community. So a group of us got together, thanks to Holland Hospital that organized all this, and we began to meet and discuss the needs in the community and discuss how this could be a win-win for everybody, for the people that needed the care, and also for the hospital not to be used as a doctor's office, because the emergency room is not intended for that.
It was wonderful to work with that group. There was a supporting group. Many of the people in the community were involved with the idea that we really can and should supply the needs for the underserved and underinsured.
Having worked at the hospital and having worked with patients who had dire needs, who couldn't speak the language, who for whatever reason would always wind up in our emergency room, and then when we'd find out that this was something that could have been taken care of at a doctor's office, that was what was driving me, and I think a lot of the other people who were on this committee that formed the health center. That's the thing that drove us, is to make sure that people had the access to health care that they needed.
We are a primary care practice. We have 2 physicians, 2 nurse practitioners, 2 physician assistants. So we have 6 providers in total and clinical staff, and we provide routine primary care practice. So immunizations, well-child physicals, physicals, chronic and acute care. Dr. Duncan also delivers about 4 to 5 babies a month. So we have the OB side of that through Dr. Duncan. So we are kind of a pretty involved and thorough primary care practice.
Healthcare is changing. It's hard to know what it's going to be like in the next 10 years. So we need to be flexible. We need to be able to adapt to how healthcare changes. And so I guess I foresee us changing with how healthcare changes, but continuing to provide quality care and perhaps even more efficiently so we can see more and do more.
We consider our patients family that come here, and they have a high degree of trust. Our providers and our clinical staff are highly competent. They know the latest studies, they stay current, they really are advocates for our patients, and so we continue to have some of the highest scores in patient satisfaction of any practice.
Despite the basically 2 decades that we've been here, there are still people who don't realize the services that we provide. So just being able to share that and get other people in the community excited so that this truly is the Holland Community Health Center, that the community knows about us, that the community supports us, not just word of mouth, but in services as well.
We had over 400 new patients join our practice in 2014, but we need to continue to get that word out. So as patients come, maybe they're new to Holland, maybe their health was always fine and they've had some different health crisis, or they just know now with the Affordable Care Act and some of how healthcare is changing, everybody is required to have a primary care, a PCP. They haven't had one. So getting that word out there and continuing to grow, but at the same time continuing to meet those needs of our patients.
Progress has been made in getting health care to the uninsured and underinsured. However, there's still a long ways to go. People still do not have access to health care as we would hope that they would have. When we raise money for the Community Health Center, we're doing a great job of providing that care to people who can't afford it. I certainly encourage everyone that supports the health center to continue that support, because it is a good thing for our community.